dealing with what we're all dealing with. But I've been so astonished at how many folks are still sort of in the doldrums, because my take is, oh my God, we have so much stuff to do. There's like targets everywhere. There's opportunities everywhere. There's stuff. We have to wake the hell up. There's so much stuff we need to be doing and that we can be doing. So the little story is, Alex, I don't know if you were on this call, but we were on some call a few days ago planning some of our advocacy work, and the call started with somebody going, oh, we can't do anything. Oh, no, they won't meet with us. Oh, this is too overwhelming. Oh, woe is me. And these were some of the, sort of really good advocates. And I hate to say it, but I think Ken, Ken, I don't know if he's here, Ken and I started saying, stop that, kick it up. We don't have time for that. Do you know how much work we have to do before the end of this year? And then how much work we have to be ready to do in January? And how much more we have to do in February? We don't have time. It's a luxury to wallow in grief. And I'm sorry, this is a fight. This is a military campaign. And now I'm starting to understand why people say, you see these war movies and they say, oh, buck up, soldier. You don't have time to, we don't have the luxury of wallowing in grief. There'll be time to mourn the person later. And I've never understood that. I'm here to tell you, I understand that now. So if you're still in that mindset, and stop it. Stop it, because we don't need you like that. We need you like this. We need you energized, engaged, and doing stuff. And like now, it's now. We have this little window when we have things we want from the White House before it changes. And then we've got a huge window of things we want afterwards. And we just have to get going on this. And that's what the whole day today has been about, right? The whole day today has been about, I didn't finish my story, I'm sorry. So yeah, Ken and I kind of kicked that up, we think, and within a minute, the whole room perked up. It was the damnedest thing. The whole room perked up and people were all engaged on stuff, and we came up with a whole bunch of action steps and a whole bunch of things to do. So if you're in that room, right, if you go back home after this great weekend and you're surrounded by people who are still in the woe is me mode, it's your job to kick them out of that. You're doing them a service, you're doing them a favor, they will be glad you did, and we need you. So that's your mission when you go home. The first most important mission is to get people out of the doldrums and into being active. So that's kind of the plan for right now. So the session right now is we're going to hear from each of the workshops, the small groups and stuff, and hear what they came up with, and we're going to construct a timeline of what all of these groups show. So just to kind of refresh, this is the triple aim, this is where we're going, this is how our strategy is built. I'm going to come back to this in just a minute. Everything that we want to do has to fit into this. There's a bunch of other interesting things to do. And if those other interesting things don't align with our strategy, our triple aim, we have to really be thoughtful about whether that's worth kicking something else up. Oh, I clicked to you.
It's okay. Hi, everyone. We started a little rushedly, so just trying to make sure we can fit in all the information. But I'm Ashley Duhon. I am a GYN oncology fellow. I'm based in Buffalo. And this is Ed Weisbart. So we talked about our triple aims. We talked about the importance of building power, that only by building power is how we're going to be able to move forward. And to review, we have this wall that's blocking us, right? We have, particularly with the last election, with the election that just happened. And so looking at the things that we need to do in order to build power, these are many of the things we talked about in these sessions. So we want to bring people up from the sessions that have happened this afternoon, and like Ed said, really build a cohesive timeline as a guiding light for our organization and for all of our individual efforts. So here is what we are going to do. Time is limited, as we've already hinted at. We're going to try to keep the campaign workshop report backs to about 3 minutes. And skills workshops, I would love a 1 to 2 sentence just review of kind of some of the commitments were made or what was talked about. We're going to be addressing these things. What was the workshop? Connecting what was talked about in the workshop to our triple aim and power building within our organization. What activities or actions did your participants in your workshop group commit to? And then what is your timeline? And that's helpful for us to actively fill out the timeline as you're giving the report backs. And to review the triple aim, again, we're gonna color code the timeline so that we can really see what each thing that we lay out, how it relates to our plan and our goals for the future. So I think we can go ahead and get started with the report backs. Let's start with the Legislative Action Group. Dan, would you like to come up? Yeah, come on up.
I'll be using my amazing PowerPoint skills.
Really amazing. I'm supposed to say this and then he's going to populate it. So our workshop, my name is Dan Doyle. I'm a family physician from West Virginia. I work in a FQHC for the last 45 years. And tired, but not done. So our workshop was called Making Legislative Action Real. And Ken wants me to kind of talk about the workshop, but also populate this graph in terms of what are the legislative priorities for this way and for this year. And he has it organized. Q is for quarter, if that isn't obvious. It took me a while to figure it out. So the first thing that he wants us to emphasize in the first quarter of 2025 is what he's called dueling letters. And this refers to the AHIP letters that have gone to Congress each year asking the congressmen and congresswomen and the senators to effusively praise Medicare Advantage and all the good things it's doing for our country. And instead, PNHP has, with congresspeople, has another letter critical of Medicare Advantage and all the bad things you've heard today that it's doing for our country and for our patients. And so also in the first quarter and through the second quarter, another priority is the legislative visits that you've heard a lot of talk about, that Lori and the other coordinator, I'm sorry I don't remember her name, two coordinators, just took us through in this room, building tension. So those are the goals for the first quarter. The second quarter is MFA. Medicare for All bills are going to be hopefully introduced again this session, presumably by Sanders and Jayapal and co-sponsors again. Then in the third quarter, one of Ed's great acronyms, LTPF, level the playing field bill, and most of you already know that what that refers to is making traditional Medicare have some of the advantages to Medicare Advantage, like vision, dental, out-of-pocket limits, so that it is better competition with the incredible Medicare Advantage pitches that are going on during open enrollment. And then also in Q3, the third quarter, I think you have said that that's when the equity report is going to come out. Two of the important studies that PNHP is doing this year, along with the moral injury study that I don't think is going to be on this table. So the equity report comes out in quarter 3, and then the idea is PNHP is going to be doing equity briefings with congresspeople in quarter 4, and then of course we're poised for where we are right now again, open enrollment, and warning people about the dangers and damage of Medicare Advantage both to patients and to taxpayers. And then in terms of our workshop, basically what we were doing in our workshop was getting people to make specific plans about how they are going to meet with their legislators in quarters 1 and 2. We had 90 people in our group, and we actually got, Mandy, we actually got 65 of these reports and plans back. So,
Amazing.
So Mandy, and basically the report asked people to write down, if in your chapter, who would come to your meetings, who else should you be reaching out to, what kind of coalition building should you be doing, thinking about who actually is in your community, so you're both using these visits to build membership in your chapter through action and to broaden your coalition for what Lori calls building tension and building power.
All right, thank you, Dan. That's amazing. I mean, look how much, it's just on this first part of the timeline. I think this is evidence in and of itself that we have a lot of work to do. It is not the time to put our heads down. It is time to really dig in, and we have all these opportunities and more to come that we're going to talk about. So I just want to, hi Shannon. You're just so ready. So I think, did we need to go through any of those particular parts, like the equity report explaining any of that?
Should we be all? So we're 99.99% sure, we're going to find out any day that we have another grant coming in to help us study the thing that Congress tells us they need an answer on. Every time we go to Congress and we tell them Medicare Advantage is hurting people, they go, yeah, yeah. Medicare Advantage is too expensive, they go, yeah, yeah. They go, we get that, we understand that. But Medicare Advantage, they're being told, is the solution to health care for the disenfranchised communities based on how much more they're enrolled in. Low-income folks don't sign on for Medicare Advantage because that's the better solution. They go to it because wealthy people can afford to reject the crappy insurance that is Medicare Advantage. So of course, Medicare Advantage has a lot of people that have low income or otherwise disenfranchised. We need to give Congress a better answer to that question, and that's what we're going to be studying with our equity report, and that's those other two red boxes.
Perfect.
Hooray.
Thank you. All right. Okay, Shannon, let's hear about what was discussed during the medical societies breakout.
I am going to end up messing up Ed's spreadsheet. I can already feel it.
It's not messing up. We're building it together. It's not messing up.
What was amazing about our group is that we had individuals from all over the country that are excited to start working on resolutions within their medical societies, as well as start building relationships in their medical societies. So about half of the group already had relationships there, were already pretty active and participated in them. About half of the group was brand new or in the process of joining their medical societies. So everyone's going to be on a slightly different timeline here.
And that's okay.
But the way that those resolutions will connect to our triple aim, certainly some of those will be single payer focused, so focused on our true north. There are others that will be focused probably on Medicare Advantage or improving traditional Medicare, and that's really going to depend on the tone within the medical societies and what the folks who joined that workshop today think is feasible and realistic in terms of what they're proposing as resolutions. So we're going to leave it to everybody within their medical societies to gauge that and develop those resolutions as they move forward and as they build those relationships. So in terms of timeline, Ed, I'm sorry to say that we are all over the place with our timelines based on when meetings are happening and boards
More
of delegates.
opportunities. It's okay.
We're flexible.
Exactly. Do you have any specific dates that you all talked about or groups to focus on?
So we have not set a date, but we will be doing a follow-up likely before the end of this year and reaching out to folks that were part of this workshop to confirm that we all really reached out to the people within those medical societies we said we were reaching out to.
Okay.
And to actually start doing the work of drafting those resolutions for folks that want some additional support with that on top of some of the tools we distributed today.
Awesome. And do you feel like there was a good representation in terms of just amongst different specialties or different groups, that there were like commitments to multiple areas?
Yeah, so we definitely had folks from across the country. So geographically, that was really spread. And something that I thought was especially fantastic is we actually even, I'm not going to embarrass and call her out, but we actually even had a pre-med student who's excited to introduce a resolution more locally within her school as well.
Amazing. Awesome. Well, great. Sounds like a lot of good opportunities. We, in preparation for this, kind of thought of some potential meetings as well that people could try to target. So I think Ed can maybe add those to the timeline as well as we're going through. Might be asking too much, but okay.
Like what?
All right. So let's hear from Diljit about moral injury.
Thank you. So we had a really wonderful session, and in some ways was different than what we had talked about. In some ways, our timeline is defined because we were talking about our Robert Wood Johnson Foundation grant that we're doing on moral injury. And so some of, as you know, we're going to be getting surveys that everybody in the room has taken. Yes, hands up, you've taken the survey? And then everyone's passed it along to at least one person? All right. So we're working on that. Beautiful. And so really, we're going to continue to collect that survey at least through the first 2 quarters, but likely continue to do it through the year. And we had great input during our survey. Our students were well represented in our workshop, and they raised the issue of designing a survey more oriented towards the issues that come up for them, so kind of evolving the survey in ways that serve us and continue to do the things we need to do about helping people make these connections between financialization and moral injury and the struggles that physicians are having in their profession. We're going to keep working on helping people talk about moral injury. We have a moral injury group, working group that we put together that we're hoping to continue to meet. Thinking about a webinar, kind of revisiting the material we covered today to try to reach a bigger group and maybe help people model and use their skills. So hopefully first 2 quarters. Perfect. We're going to start doing interviews in the second and third quarters. And so ideally from those surveys, we recruit people who are willing to do interviews. Even beyond that, for people in the room who find people who'd be willing to be interviewed, we'll be reaching out and educating you all about that as we get there. And then we're hoping to have results and a report. And we're committed to RWJF to get them a report by end of year. So that'll be Q4. But I think even before then, we're going to start working on what next for the Moral Injury Project, whether that means focusing more on the structural racism and inequities part of the project, trying to focus on groups like OBGYNs who specifically struggle with a set of issues tied into the reproductive justice issues that bring up how the control of medicine is being moved forward. I don't know, there's nothing good. There's no good way to frame that.
Can I ask,
Yes.
did you all talk about how you would plan to make the next step with the survey? So we're giving the survey out to everyone, but then how do we follow up? How do we bring them into our movement once we expose them?
So there's a little challenge there, because ideally, the way we bring people in is we help make that connection, help them understand that the struggles they're having are not going to be solved by a chief wellness officer teaching them to meditate, right? It's going to, and I think that really fascinating thing in medicine where, like, as a group of experts, we work on things like, figuring out the human genome, curing cancer, transplanting any kind of organ you can think of, but somehow we don't think it's possible to change our healthcare system, right? And because we don't think it's possible, we've never designed solutions for physician burnout, moral distress, however we choose to describe it. And so I think that helping people evolve that conversation, right? Helping people have that conversation of, like, join us, do this survey, hear the language, hear about how this is an organization that's thinking about you and how you practice your profession, and that's thinking about solutions, and knows that that solution is fixing our healthcare system. And so, like, I'll be honest that I'm not pushing people as you're trying to get people to do the survey to do a hardcore PNHP sell. I'm encouraging you to help people see that connection. And we hope that those conversations continue and that people sort of naturally understand and evolve to join the movement.
Amazing. Thank you so much, Diljit. All right.
In case you were worried that we weren't going to have Phil as president after tomorrow, rest assured, Diljit is, presuming the board agrees, Diljit is very likely going to be elected president tomorrow, and we're really, really lucky.
All right, let's hear from Toby for Local Power.
Awesome. So Brooke Rovell and I hosted the Building Local Power workshop. And I was very fortunate to be part of this amazing team. And really, Brooke led us off with a great definition of power, and power as really organization of people, or organized people, and organized money. After Brooke kind of took us down the journey about what is power, Robel told an amazing story about a campaign that he was part of in Denver to raise the minimum wage. Kind of after hearing those stories, we then turned it over to our audience and gave them a worksheet where we asked them to set very specific goals. And unlike Shannon and being very flexible, we were very rigid and said, we want goals for 1 year.
Yes.
Because we wanted to help that out here.
Can attest. Felt very anxious about having to do that.
We also wanted to talk about what some strategies were for recruitment, because we know that power is the organization of people. So many of the goals that were set were really kind of longitudinal over the course of the entire year. But we wanted these goals set very specifically at the beginning of 2025. We then went into some of the challenges that we may experience, and this is where we kind of talked a lot about kind of what some of the barriers are that we are up against in terms of like the insurance industry and their desire for profiteering, as well as some of the political challenges that we were going to face. And finally, we touched base on what is at stake if we're not able to build this power. And so we had members who committed to holding one-on-one conversations with new or prospective members, and at a frequency of at least twice per month for the next year. We had members who committed to using actually a very kind of something that we can all agree upon, and that is that no one should have to suffer from medical debt, and to use that as a unifying force in a state where actually they don't have a PNHP chapter, and a group of undergraduates are leading their SNAP chapter and trying to build power, which is amazing. And so once again, I think we actually did make Ed's life a little bit hard, because now he's got to put all these rainbow colors up there, because all of this really intersected across all three triple aims for PNHP, because in order to achieve anything that we want, we need organized people, we need organized money.
Thank you. Yeah, I think that this session was, first of all, let's give it up for Toby. Thank you. Yeah, new board member. I think that this was when we were conceptualizing how are we going to build this timeline for ourselves as an organization. How do we build in local power, right? And how do we make specific goals? And it's hard to do that organization-wide. It's more based on what your experience is within your local chapter. And we come to these meetings and we feel so inspired and enthused and motivated, but the work starts when you get home. And so even if we have some concrete time points on this, but that local power building is throughout the year, and you can build that timeline for yourself. And that's what we did during this session, which was incredible, to really critically think through that and think about, okay, at this point in the year, I'm going to do this, and then have this many people, and my goal is here. And so we put it throughout the whole year, but I encourage all of you, even, not just chapter members, not just board members, all of you to really try to think of a strategic plan for yourself for the next year of how you're going to increase the power within your local area and amongst the people around you. All right, I'll take that. So we are going to move into some quick reports from our skills building sessions, because we don't want to forget about those. It sounds like they were incredibly invigorating and really came with a lot of education. So I would like to keep these to 1 to 2 sentences, just if we could talk about kind of commitments that were made or anything exciting that might have come up during those sessions. We'll talk about coalitions first.
Yeah, so I'm Brian. I worked with Betty and Alex facilitating the coalitions. We talked about basically thinking about having a Medicare Advantage legislative meeting and what partner organizations you would want at that meeting, how you would sort of pitch going there, and what you anticipated their contribution to be, how closely allied they were, and how much power. And Alex in particular talked about a goal of, if you have a group that is strongly allied, work on building up their power and their influence. And if you have a group that is influential and powerful, work on building their alliance. So.
Perfect, cool. Thank you. Yeah, so really working with our colleagues to help build up their movement so they'll build up ours as well. Let's move on to communications.
So yeah, I was with the Communicating Clearly and Effectively group. So what is communicating clearly and effectively? Well, it's more than just restating, ironically, the title of the workshop in a tautological way. It is, just so you have some context, there was 37 to 46 people in the room, I would say. We learned about the importance of how to write a good message. A good message should be short. It should have details that are specific. It should have relatable content, and it should include a call to action. So I'm going to kind of mirror that now. My plan is I'm going to write a letter to the ACMG. I'm very excited about that. I feel like I have spent a lot of time waiting for my chance to become a geneticist, and all these people don't have the care that they need. And the person that writes that letter that makes a difference could be any of us. It could be you. It could be you. It could be you. It could be me. So that's my message to you, is that you should write a letter. So yeah.
Thank you. It's perfect. All right. We'll bring up Krita to talk about membership.
Oh, yes. So for recruiting 101, we had about maybe 25, 30 people. And we learned from Andy how to look at our networks, our different contexts that we're in, whether it be work, whether it be your medical society, and identify 3 to 5 people that you can really talk to who are supporters, who might possibly be supporters, and try to get them engaged, try to understand where they are. And we learn more about one-on-one recruiting, what it really takes to actually have that conversation, get people engaged, learn their story, and move to the fact that we can get them to single payer and PNHP, and how that could be a great outlet for them. And so we're all committed to kind of continuing to build these skills and work on them as we work to get the people that we identified in our network to PNHP, and then actually helping nationally with phone calls that we make with our renewal members, with the moral injury respondent follow-up, so we have many outlets for people to actually practice these skills.
Can I ask you a follow-up question? What advice do you have for people who may find it very intimidating or daunting? Because I think, as someone who's also involved with recruitment and outreach, that even myself, I have trouble making these cold calls or trying to approach people and talk to them about PNHP when it's something that we're also passionate about. We wouldn't be in this room if we weren't, right? It shouldn't be that hard. But do you have any thoughts or anything that you can add just as some inspiration for people in the room?
Yes, no, I mean, you're right. It's difficult for all of us. I think, especially since we moved away from phone calls, especially, and we do more emails and textual, it's hard to do that personal connection. So it's difficult for someone that's been doing it for a while. So know that you're not alone, but that by doing it and doing it more often and really taking the initiative to do so, it does become easier. You do feel more practice. Things kind of roll off your tongue, and it becomes very, very enjoyable because you actually start to connect with people, start to learn more about the people in your networks that you didn't know about, and so that's that's a reward in itself. So just do it more often.
Yeah, just do it. Perfect. Thank you. All right. I would love to hear about leadership from Zach, our lovely New York Metro student fellow. To point
Hi,
out.
everyone. So Jen, Mandy, and I hosted a workshop about leadership and about hosting effective meetings. As part of the workshop, we focused on creating inclusive meeting spaces, and along these lines, setting community agreements that were inclusive during our meetings. And we also focused on creating agendas that are action-oriented, emphasizing that a lot of the work happens between meetings, so how to create agendas that set us up to do organizing work in between our meetings. About 15 people attended the workshop, and during the workshop, we each created an agenda to use at our upcoming SNAP or PNHP meeting.
Amazing. Thank you so much. Yeah, I think it's really about moving us, again, from talking to action, and that's so important. So thank you so much. All right, let's hear from Belinda, talking about meeting with our elected officials.
Hi, everybody. I had the pleasure of leading a workshop with Lori and Hannah, and we were focusing on using tension as a tool to build power with our elected officials. And by the end of the session, everyone had their own worksheet. We passed out 60 worksheets. We got back more than 60 worksheets completed. People used loose leaf paper and filled out this worksheet to indicate the name of the legislator or elected leader they would like to engage and build power with, what is at stake if we don't build power with that legislator, what are some strategies to build power, to build tension towards gaining power towards our agenda with that elected official, and how can we, when successful, then extend that power further. So it was a wonderful session, and one of the last sentences that I want to share with you is what one of our attendees said with their sheet in hand. I have a plan now, so I just have to do it. And we had 80% of hands raised about readiness to take that action.
Perfect, thank you. Forgot to mention another one of our newly elected board members. So great, I think, this is an incredible piece that we have created, and we created this together through all of our time that we spent in these workshops throughout the afternoon. I hope that each and every one of you sees yourself at least at one part of this timeline and how you can really dig in and get to work with what we laid out here together. This is your timeline, right? This is not the staff members, this is not the boards, this is our timeline of how we're gonna move the needle forward despite what happened last week. So I think I'm gonna hand it over to Ed to close this out.
Yes, we'll almost close out. You close up after I close. Yeah. And then somebody else will close. Yeah. So I wanted to get a chance to just to talk for a moment because the organization has evolved and changed so much in the last 36 years, and particularly the last few years. And what the key thing I want to try to make, key point I want to try to make is we are only here because of all the things that we did all of these years to get here. The stuff that we're doing today, we frankly could not have done 10 years ago or 15 years ago. And the stuff that we were doing, or some of us were doing 15, 20 years ago, inexorably led to where we are today. So I want to take a moment on that and just look at sort of policy milestones. So I don't know if this is sort of almost in the background now, but a lot of the sort of elder statespeople in our group got turned into PNHP because of the writing of the physician proposal in 1989 and publishing it. As Shruti and Swathi said, publishing is the love language of wonks. So publishing the physician proposal in 1989 got us really kind of in place. And that led inexorably to a lot of work that got John Conyers to file the single payer bill, which PNHP had a big voice in crafting, which then of course led to Representative Jayapal and indeed Senator Sanders doing what they did. And hats off to Sanders. I mean, that kicked us above the fold in the newspaper. All of this time, we were still in this space though. We were still primarily doing research and education. That's always been sort of our DNA. Our culture had always been this notion of, well, you can't get to single payer, you can't cross a chasm in 2 leaps. What we're talking about is a pretty abrupt change from the current healthcare system. And so the mantra of the organization had been for decades that you can't cross a chasm in 2 leaps. And I was, when I came in, I was pretty critical because I was saying things like, well, I've been to the Grand Canyon and I've seen people who tried to jump across and there's a lot of dead people down there. That's not how you cross a chasm. You cross a chasm by shooting an arrow across and then making that into a bridge and then making that where the trains go. That's how you cross a chasm was my mind. And I was actually kind of aggravated by the idea of 1 leap across the chasm. But I'm here to tell you on reflection, that was exactly the right message for that period of time. It was straightforward. It was just do the darn thing, and as we heard today, just do it. So I think that's not the message. Maybe it is still the message, I don't know. But we're much more focused on, of course, we have to cross the chasm, we have to pass the bills, and hopefully Representative Jayapal will talk about that a bit. But the whole day today was, how do we build this? How do we build this? How do we construct the train that can drive us across? What does it actually mean? And hopefully that's what you took from today. Milestones for advocacy, I don't know if you remember this, but about, was it 5 years ago or so, we kind of started testing, can we build a campaign? We didn't know, we'd never kind of tried to build a campaign. So we did this whole series of kitchen table campaigns and built the skills. We built the skills. Those were like, 10 different themes. And were all really good, but those were new to us to build the skills. That led us to be in a position where we were ready to do the DCE campaign and then the ACO REACH campaign, which fortunately, in case you're wondering, we still have all those materials. So if Project 2025 happens and they bring it back, well, we're all set. But that was what we needed to be able to do there. And that work was sort of like the beta test, frankly, for our current anti-profiteering campaign. All of these things, and the first 2 sections of that I'm showing you, they led to PNHP having the power and skills to do this. And so strategically, we created SNAP, thank goodness. I think of SNAP sort of like yes. I think of SNAP like the way the Federalist Society invaded law schools 40, 50 years ago and now owns the Supreme Court. That's what they did, right? The Federalist Society didn't try to get the Supreme Court. They spent generations getting there. We want to do it in 1 generation or less. But SNAP is cool. It's fun. We're so glad. It's the future. It's a strategy, though. It's a strategy, and it's important to recognize. And you saw this. Shruti and Swathi showed you that, and so hooray! We've never been able to do that. Our advocacy is working, and now we spent the whole weekend and tomorrow developing a strategic plan. That's pretty awesome. So we have evolved to a place that we couldn't have gotten to had we not done what we've done. So now we got this.
Yeah. So I know that. Many of us may have come into today feeling demoralized, having a whole slew of a variety of feelings about what's transpired and continues to transpire every time you check your CNN updates or whatever your news updates are, I feel. And we may have come into this having this as our timeline for the upcoming year, not knowing how to proceed, not knowing how to make an impact. But I think it's so important, again, to point out how much just planning and strategy that we've talked for the rest of the year, and that I hope that you will at least have one person make you accountable for something that you've committed yourself to today. I think that's a big problem. You go to these meetings, you feel inspired, you have this plan, but we're bad at holding ourselves accountable. So have someone else hold you accountable so that we can really make this change happen throughout this year despite these circumstances. You are this timeline. So, I just also want to add that, and I think this has already been said throughout the day already, but if we throw our hands up, if we silence ourselves, if we back down, we are letting them win. We cannot let them win, okay? And if we do not dig our heels in, put our heads down and get to work, then we're gonna go way further back than what hopefully is not what happens in the next 4 years. But all of us in this room are the future of this organization and our movement. And I wanna quote Ed, who actually said this earlier, sure, the water is rising, but we know the way to higher ground as an organization. We are an advocacy home for everyone in this room and everyone around you that may be like-minded. So let's get to work.